With recommendations in place, health departments in West Michigan must now decide how to move forward with the Johnson & Johnson vaccine. Fox 17's Marisa Oberle walks us through the plans being developed by local officials to restart vaccinations.
In the moments after a Centers for Disease Control and Prevention panel urged COVID-19 vaccinations with Johnson & Johnson's to resume, health departments in West Michigan followed the advice.
We will be switching back some of our clinics.
Sarah Cerna says the Barry-Eaton District Health Department plans to soon administer the single-dose shot. Prior to the pause, J&J represented less than 1% of doses given in each of the department's counties and were largely distributed to outside partners like pharmacies. Cerna says the vaccine helped them expand to more rural areas.
It's really good for populations that have a hard time making time or having transportation or experience other barriers to a medical appointment to receive a vaccine because they only have to come in once rather than twice. And the other thing that makes it a more accessible vaccine and makes it good for distributing to our other partners is it's a little bit easier to store.
As for when the J&J shot could go into people's arms, Cerna says it depends on their current supply of it and how much is eventually delivered. But for other departments, it's a decision still being made. Muskegon's public health director telling Fox 17 in an email there are no plans to immediately resume administering it, and they will gauge the public's level of interest before planning any clinics. An Ottawa County official said, quote, "We will discuss the implications within our health department and next steps. Currently, our supply of J&J vaccine is properly stored and will not expire until late June." While the responses may differ, all departments could face decreased confidence in the shot due to the pause. Cerna hoping people instead see it as a reason to believe in it.
That is an example of the system working. That is an example of how much we care to, not only stop the pandemic, but also to make sure that vaccines are safe.
Marisa Oberle, Fox 17 News.
A spokesperson for the Kent County Health Department says they will likely discuss the recommendation and make a decision next week.